Hello.
Good morning.
Good morning. Thank you for coming here, Professor Scott.
Oh, it's my
I,
pleasure.
I had the pleasure of meeting you during my visit to Chicago. We visited your office at UIC, and I definitely, we had a very interesting conversation. Uh, First of all, would you introduce yourself to us, like to our listeners in the
Sure.
All Pulp No Fiction podcast?
So I'm Dr. Scott Tomar at UIC College of Dentistry, and my role at the college is Associate Dean for Prevention and Public Health Sciences.
I see. And when we were talking, you had a unique perspective on how dentistry should be, you know, should let's say evolve from our current dentistry that everyone's practicing. Would you talk to us a little bit about it?
Sure. So dentistry has for many years been primarily a fee-for-service type of reimbursement.
Mm.
So and again, not saying that that dentists are not good people, but the nature of human behavior is people will provide services or do certain behaviors based on their incentives.
Mhm.
And so if we have a system that's incentivizes providing services, fee for service, they will provide services, which may or may not necessarily coincide with improvement in oral health or overall health or quality of life.
Mhm.
So what we're trying to do, a model that we're trying to test at UIC, is to develop what's known as a value-based model of dental care delivery, a model that's focused primarily on preventing disease, as well as minimally invasive management of disease when it occurs. And at the end of the day, what we hope to show is we can actually improve people's quality of life, their oral health, their overall health, through an emphasis on the prevention and really trying to manage the disease with as little intervention as we can.
Okay. In your opinion, what would be the biggest obstacles for for this project to actually see the light or like to be implemented like nationwide or like worldwide?
Well, I'd say, certainly change is very difficult in almost everywhere. Certainly it's
Basically.
true in the dental profession.
Mm.
And again, the overwhelming majority of dentists, they were trained and have grown up and still practice and primarily thinking of the world in terms of a fee for service model.
Mhm.
How much do I get for this particular, for whether it's a crown or root canal treatment or, whatever that service is.
Yeah.
And so that's how we think. That's how dentistry, even how we approach patient care.
Yeah.
Dentistry really doesn't have wide adoption of diagnostic codes, but we have extremely wide adoption of treatment codes. So we're taught from the very beginning of our dental education to think in terms of procedures. And again, we socialize our students to think about that. This is really trying to turn that the whole paradigm around.
Yeah.
It's not about providing a certain service. It's about the endpoint. What can I do that will actually make my patient's health better?
Right. Yeah.
So again, we have not that we've reached, nirvana in terms of prevention, but
Yeah.
we have more things available now to oral health care than ever before in things that can help us prevent disease among our patients and to provide as little clinical intervention in that process as we can in managing that disease. And yet we lack incentives to do that. So again, from a dentist perspective, they're running a business. What is their incentive to spend the time counseling a patient on diet or trying to reduce their caries risk,
Mm.
by having them use appropriate preventive agents like fluorides, and again looking at changes in their diet when it's actually much more lucrative to me to I'll
So
just go
just
ahead
making
just go ahead and do the filling already. Why
Yeah.
would I want to try to manage this this beginning cavity
Mm.
when it's a stage where I can still reverse it? Frankly, my incentive is to treat it.
Exactly.
And so
right, yeah.
I think that's certainly one of the bigger barriers. How do we change the whole mindset of dentistry? Certainly reimbursement's a big part, but it's really just changing the mindset of how we manage the oral health of patients and communities.
I see. And in your opinion, meetings like this, when we were in the IADR in New Orleans, meetings like these, like how do they help in changing this mindset?
So I'd say there's certainly, I'd say a fair number of researchers that understand this. So I'd say many of the sessions that I've gone to are focused heavily on various aspects of preventive behavior, whether that's policy changes that would incentivize it. I've actually been to several sessions focused on behavioral. How do we help human beings change behavior, which is again a difficult thing to do.
Yeah.
So I think that there's certainly recognition among a sizable number of researchers. On the other hand, still a lot of research is focused on what's the latest and greatest restorative material, what's the best implant system. And again, those things have their place,
I
but
mean, yeah, both need to kind of proceed, but we also like need to recognize that we need to change the system a little bit, right?
exactly that.
Yeah.
I mean, and the real, I'm not naive enough to know that we will never need to do restorations again. No, I mean, I don't think that's realistic. But I think that when I say we, funding agencies, researchers, academic institutions need to recognize we need to pay at least as much attention on the things that will keep people, out of the need for advanced care as we do. I know as sexy and exciting it is to see all the new technological developments. And again, this is great. I'm not anti-technology, but sometimes I just wish that there was as much recognition in our dental curricula and in researchers. Research funders' areas of interest. I wish there was as much interest in what can we do to try to
actually prevent
people.
this, right?
If I could keep their teeth in their mouth, well, again, some people will always need implants, but at the end of the day, if I could keep fewer people with their own, natural teeth, that'd be great.
Yeah. Anyways, thank you very much, Professor.
My pleasure.
Appreciate you sharing this information with us, and hopefully more people will actually start to adapt these kinds of ideas.
We're trying one step at a time.
Yes, thank you very much.
My pleasure. Thank you.
Appreciate it. Yes.